Well, I know it has to do with quality of life when you're dying, which is so important, and you strive for that throughout your life. But what does hospice exactly do, and what does it mean?
I look at it this way. Hospice is a philosophy of care, and it's an implementation of the philosophy of care, of course, but end of life care. And to me, end of life care is just as important, if not more important, than beginning of life care. Now, look at how much care we put into mothers who are preparing to have their first child, and then the newborn, and adolescents, and any other significant lifetime span of healthcare. End of life should be just as important, if not more, because we have a whole lifetime worth of behind us, and we have to treat the individual with that respect. And it's about dignity, it's about quality of life, making the last, how do I want to put it, the end of your life, however long or short that may be, let's make the most of it every single day and make the best of it every single day. A lot has to do with when we talk about quality of life, and some diseases are very debilitating and very painful, and we are really regard comfort as the number one measure for quality of life and being comfortable.
How do you ascertain how to change or to take care of a cancer patient, for example, versus ALS or Alzheimer's? How do you make the differential? Or just old age? How do we do that?
You start by, you look at the individual and their diagnosis or diagnoses, whatever the comorbidities are, and we can somewhat predict what symptoms may manifest themselves. So as a nurse, we do a lot of symptom management, and a lot has to do with the disease-specific symptoms that are presenting themselves. And there are a myriad of end-of-life specific symptoms that we have to be able to recognize and manage. So we have two things. Somebody with cancer, for example, that's metastasized to their bones, is more likely going to be in a lot of pain, for example. So we carry that through, and then towards end of life, when the body's actually dying, we have to assume that the pain's still there, but then there are now a number of other symptoms that present themselves when the body's dying that we have to manage as well.
Okay, and what do you do for that management? That's what I want to know, the nitty-gritty.
Yeah. Typically, common symptoms of end of life when the body is actively dying, as we describe it, when the body's going through its natural process of dying. The respiratory pattern of a patient can change, and they usually does. There's a unique end-of-life respiratory pattern called Cheyne-Stokes respirations. It's a very different pattern. It's very outstanding. When somebody sees somebody breathing that way, it's very rapid and kind of shallow, but then periods of apnea or stopping of breathing in between. Mm-hmm. And that can go on for a minute, and then they'll start breathing again. And then, so that is one example of a symptom that can be very disturbing for family. It can be very uncomfortable for the patient. So we use medications like morphine and lorazepam to help relax the breathing, slow down the breathing, and the patient's allowed to get a better breath. So that's an example of how we manage a symptom such as dyspnea or shortness of breath or the Cheyne-Stokes respirations.
And we always seem to want to have our patients eat.
Right.
And that slows down too.
Eating and nutrition and hydration are a big thing, and it's been a pretty significant topic for me as a case manager in the past couple of weeks. We associate nutrition and hydration as life. Mom or dad, brother or sister have decided to stop eating now, and I tell a lot of patients there's a difference between not wanting to eat and stopping eating. At one point when the body's ready to die, it no longer needs nutrients, it no longer needs hydration, and it goes through its own process. So it goes back to your misconceptions. One of the misconceptions, oh, my dad's dehydrated and he's dying, we need to give him fluids. But the body goes through its own dehydrating shutdown process. And so when we add fluids artificially, sometimes it becomes overload for the body, and now the body fills up with fluid, with edema and fluid in the lungs, and it makes the respiration, and it's very, very difficult. The compassion thing, oh my God, I don't want my dad dehydrating to death or not eating or starving to death, but it's actually the more natural way to let the body go through its own process.